Good afternoon, Puan Azia and Miss X. I'm Sammy Ling. Today, I'm here to teach your caregiver, Miss X, to perform perineal care for you when you are discharged. So, this perineal care is to maintain the hygiene in female perineal area, to prevent odor and to maintain your comfort when you are at home. So now, Miss X, I'm going to teach you female perineal care in short while, okay? So now I'm going to show you what is our learning outcome for today. So our learning outcome is to determine the needs of patients in assistance with perineal care, to identify signs and symptoms of female perineal infection, to prepare the equipment for female perineal care, explain and show the composite skill, and the last one is to perform female perineal care appropriately. So before we start perineal care, we need to assess Puan Azia general appearance and general conditions, like such as is Puan Azia in pain, or is she having any odor from her. So if she has this, you can saw her discomfort, then we can ask for her permission to assess her diapers and check and see whether she is fast urine or fast motion. Then if yes, then we can start the perineal care for her. Okay. So before we start the procedure, I also need to tell you that we need to assess the sign and symptom of female perineal care infection. So when you before we start the perineal care for her, we need to assess is there any sign and symptom of female perineal infection, such as itchy and irritation in vagina and vulva, or is there any burning sensation, especially during urinating? Is there any redness, swelling of vulva? Is there any vaginal pain and soreness, vaginal rashes? Then, is there any thick, white, odor-free vaginal discharge with cottage appearance, watery vaginal discharge, such as this photo? Okay, if you found out Miss Puan Azia having any one of these signs and symptoms, you need to notify to Puan Azia family member and doctor immediately to seek for the attention and to reduce Puan Azia discomfort. Okay, so now we need to so now I'm going to show you the equipment to prepare to perform the female perineal care for Puan Azia. So we need clean non-sterile glove, and then bedpan, which is here, and then bed protector. You can use either waterproof pad or this one plastic bag, and then basin and warm water inside. You can choose soap or feminine wash, and then towel, warm wash clothes and clean linen, okay, and laundry bag. Okay, so now I will show you the composite skill. Okay, so Miss X, now I'm going to show you the composite skill, which is we call it important skill of for the female perineal care. So the first skill is you need to expose the perineal area and then separate the leg, Puan Azia leg, and then we need to put either the waterproof pad underneath, or we can choose the truss bag to put underneath to prevent the bed sheet to get wet. Okay, so first we need to wash the inner thigh and the outside of female perineal area. Okay, this is the first important skill. The second skill will be after we wash inner thigh and outside of the perineal area, So now the second composite skill, which is the second important skill, is we use our non-dominant hand to open up the layer, and then we clean from outside layer to inside, and then we need to clean from front to back. Okay, when we clean the layer, we need to use its different stroke of the towel, such as you see. When I clean this layer, I need to change another side to clean another layer. So to prevent the same stroke go to the patient. This is to prevent the dirty part and bring the bacteria to go to the other side. Okay, so when we already clean the area, we need to pat dry the area. Okay, so when we need to dry the female perineal area, we need to dry from inside to outside. Okay, because the inside we already clean, so we do not want to bring the outside germ to go in again. So when we dry, we need to dry it from inside to outside. Okay, so after we clean this area, we need to dry it. So before we dry it, we need to rinse it, use the water to rinse it, and then only we dry. So when we dry, we need to dry it, pat dry from inside to outside. Okay, because this area we already clean, so we do not want to bring the outside germs to come in again. So when we dry, we need to pat dry from inside and then to outside. Okay. Okay. Remember that it is important to perform female perineal care once a day or necessary for Puan Azia, because this is to maintain the hygiene for Puan Azia. So we also need to remember that when we perform the female perineal area care, we need to clean from outside to inside, and then from front to back, and then when we want to dry it, we need to dry it from inside to outside to prevent the infection. Okay. Okay. Before we go to the skill, is there any questions you want to clarify? No. Okay. Then I have two questions for you, which is, what is the purpose of perineal care?
The purpose of the perineal care is for patient's comfort and to prevent infection.
Yeah. Okay. So well done. So the correct answer is to prevent skin breakdown, to prevent infection, to prevent odor, and to provide comfort. Okay. Okay. The second question: what are the important skills for female perineal care?
Okay. The important skill is, first have to clean from outside to inside.
Yeah.
Then from front to back.
Yeah.
And then if let's say dry up, have to dry from inside to outside to prevent cross infection.
Yes, correct. So the answer is, the important skill that you need to know are wash female perineal area from outside to inside, from front to back, and pat dry from inner layer to outer layer, also from front to back during cleaning the perineal area. Okay. So now I'm going to show you the proper skill to perform the female perineal care for Puan Azia. Okay. So now I need to wash my hand. Okay, you wash my hand ready. Wash my hand, and then you need to wear the glove. Okay. So after we wear the glove, you can close your room door, or we screen up the patient to provide privacy for Puan Azia. Okay. So after that, we need to inform Puan Azia. Okay. Puan Azia, now I'm going to perform the female perineal care for you. Okay. So after that, we need to expose exposed, and then need to separate her leg. Okay, see? So after we separate the leg, we need to put in the trash bag to prevent the water goes wet the bed sheet. Okay, so we need to tuck in. Okay, tuck in. So you can either tuck in or you can put the big pen underneath for Puan Azia. Okay, to let the water to go in here. Okay, so later on I will use the model to demonstrate for you. Okay, so okay, so now after we put in the bag, the plastic bag, we need to use the warm water. Okay, we need to use the warm water and the towel. Okay, so first we wet the towel, and then we clean the inner thigh and the whole area. Okay. Okay, after that you need to wash again the towel. Okay, sorry, before that, you can either use family wash for Puan Azia or use soap to clean the female perineal area. Okay, so after that, we need to use our non-dominant hand to separate the layer of the labia. Then we clean from outside. Then we change another part of the towel, and then we clean another side from outside to inside, and then from front to back. Okay, then after that we go to the inner layer, also front to back, and then we change another side of the towel, and then we clean another side. Okay, then after that we clean the center. Okay, so now we can let go, and then we rinse the so after we clean the towel, so we need to dry the area after we clean. So now when we need to dry from inside to outside. Okay, so we need to dry from inside to outside, and then from front to back. Okay, so now after we have done the area, we need to clean the towel again, and then now we clean the anus. Okay, so we clean the anus, then we dry it. Okay, after we done this part, then we need to remove the pad. Okay, and then remove the pad, and then we need to put into the laundry bag. Okay. Put into the laundry bag. So after that we can either use the clean clothes to change from Puan Azia, and then comfort her. Okay, then after that remove your glove and throw everything into the dustbin. Okay. Okay, after we throw the glove into the dustbin, and then we need to wash hand, and then comfort Puan Azia. Okay, so now do you have any questions on this?
No.
No, then can you show me again the steps on perform the female perineal care?
Okay.
Okay, so now you can start.
Okay, first I have to do a hand washing.
Yeah.
After that, then dry up my hand. Go and wear my glove.
Yes.
After wearing the glove, then I have to position Puan Azia. So first, material, and then after that, apply the underneath one area, and ask the one area to cross the hand to pick up the laptop. Okay. After this, I prepare every equipment that I need, such as my big pen, my feminine wash, bedsheet. If let's say soil the bedsheet, I have to change, and my clinical waste, especially. Open up the clinical waste. First, I have to use the towel. Water, squeeze it up, and then to clean the thigh, make it clean, and rinse again. Now go to the vagina area to clean the vagina, go to the anus, and then after that put it with the feminine wash, mix together, and now start the procedure. Use my non-dominant hand, open up the fold, and then area by area to clean up. Open up my towel, first outside, from front to back. Another area from front to back. Now go to the inner area from front to back. Another part. Use the same area front to back. Then now another part. Vagina front to back. Let go. Again, then go to the next part. Then use the dry cloth. Use the dry one. Dry one has to clean. Inside to outside. Yeah, inside to outside to prevent cross infection. Same, last is the inners. Then throw into the machine. Remove my glove. Yes, and then wash my hand. And comfort one area. Yeah. Then position back, remove the dirty soil back. Yeah. And then if let's say the bedsheet have soil, we change the bedsheet. Yes. Then comfort one area.
Okay. Now here we going to end our lesson. So as a summary, we need to perform female perineal care for one area when there is necessary, and before we perform female perineal care for one area, we need to assess for any sign of infection, and we need to use our composite skill, which is important skill that I teach you just now to perform the female perineal care. Okay, it is important to use the important skill to perform to prevent cross infection and to prevent microorganisms to go into female perineal area. Okay, here we end our lesson. Okay, thank you.